So people experience a range of thoughts and engage in a range of behaviors. And so that range can go from kind of a passive desire to die, passive desire even to just not be here is something that people say, all the way to wanting to take one's life. It's really important to be able to differentiate, to kind of notice the difference between the two. Thinking about suicide and following through on with behaviors of suicide, like suicide attempts, are actually two different things. There are a lot of people who experience suicide thoughts, passive or more active, chronically, like a lot of the time, that don't ever intend to act on these thoughts. So there are a lot of different warning signs that you can look out for. Some of them are kind of more obvious. If someone is telling you that they want to die, if you found a note, if they are giving away their personal belongings, those are some of the warning signs to look out for. But then there are other kind of less obvious warning signs. So increase in substance use, spending a lot of time alone, not doing the things that they typically enjoy, excessive reckless behavior, so a lot of speeding or excessive spending, kind of behaviors that don't make sense for them, are some of the other things to look out for that might not be as obvious. The most important thing is to talk to the person. Don't be afraid to ask them if they are having scary thoughts or suicide thoughts, and be really clear that you're not judging them, that you just want to talk with them. I think one of the most important things is to approach a loved one, someone you care about, really non-judgmentally, and be willing to talk, willing to listen, and don't even necessarily offer any advice at first. If a person is having active suicide thoughts, there are some resources, and there's actually some cool new things popping up on social media. So there are text lines, the National Suicide Prevention Hotline is available, and Facebook is kind of funneling in some, I think Instagram as well, some places where they might intervene if they notice somebody's suicidal, but also places for people to indicate I'm at risk or a loved one's at risk. You can also go to the nearest emergency room, or take somebody to the nearest emergency room. I know here at Sheppard Pratt we do have a walk-in clinic, so there are other resources like that around the country as well. So there are treatments for suicidality and self-harm. There's a lot of research that goes into this. We know that there are certain treatments that work. There are large studies that show this. So I just kind of want to end by saying that if you are suicidal, if you experience suicide thoughts, things can get better for you, and it's likely true that you're in the middle of not believing that, and other people in your life where you hopefully can remember at some point that you will get better. So please seek out the treatments that are specific to the problems that you have and specific to suicide.